Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A majority of babies born in the United States are breastfed, at least initially, but new parents often have lots of questions. August is National Breastfeeding Month, so I'm talking about breastfeeding with Dr. Cheryl Dumond-Martinez. She's a pediatrician and breastfeeding medicine physician in Upstate's Department of Obstetrics and Gynecology. Welcome to the Informed Patient, Dr. Dumond-Martinez.
Thank you so much, Amber. I'm really excited to be here.
Government data shows that 86% of babies are breastfed at first. Does that line up with what you see among newborns here in Syracuse?
Taking a look at some of the most recent data from the New York State Community Health Indicator Report dashboard, this is data from 2021 to 2023, shows an interesting story. Sometimes the numbers give us good information, and sometimes we really need to do a lot of interpretation of what it means, because 77.2% of infants in Onondaga County were fed any breast milk at their delivery hospital. But that doesn't tell the whole story. If we then look at exclusively taking breast milk, that's 57.8%. So that's a notably lower number. And then if we look further out at 6 months, 25.5% of infants who are receiving WIC continued breastfeeding at 6 months. And that, I think, tells us more of the story, but still doesn't capture individual experiences. And I think what we see with some of these numbers is that we might be doing a better and better job of helping women breastfeed initially, but we may not be supporting them along their journey as time goes on.
What is the typical length of time?
That women breastfeed
Yeah,
or
it's
what's
like,
recommended.
well, both, I guess. Is it 6 months?
Yes, so the American Academy of Pediatrics and the World Health Organization both recommend exclusive breastfeeding for about 6 months, and then the introduction of complementary foods, but continued breastfeeding for as long as mutually desired, and that may be up to 2 years or beyond.
So mutually desired, that depends on the baby too. The baby may wean themselves.
Yes, mom may decide to continue or maybe runs into some barriers or decides not to. Or, yes, sometimes babies get really interested in solids and decide they're happy to be done breastfeeding.
Now, are all babies born hungry? Do they all want to breastfeed as soon as they're born?
I hate to generalize, but there are certain circumstances, such as premature babies or babies who are born ill. And that's a different story, I would say. But babies who are born healthy and at term, for the most part, what we're going to see after delivery, again, if they're healthy, is that they cry right away. And that's a great sign. We're going to have higher APGAR scores if that's the case and not need any special resuscitation or anything. And then within that first hour, we call it the golden hour. If a baby is allowed to go skin to skin with the birthing parent and offered the opportunity to be near the breast, many babies will, with help potentially or on their own, find the breast and initiate latching at the breast. So, in a way, yes, most babies are ready to feed. And if we catch that in that first hour, we're more likely to be successful.
What are the benefits of breastfeeding for, I guess, for the baby and then also for the mom?
I'm glad you asked it that way because there are benefits to both. And I think sometimes we talk more about the benefits for baby, and it's important to think about both. Breast milk and breastfeeding for the infant serves kind of two primary purposes. We think a lot about nutrition and growth, of course, and that's a big part of it. And we know that essentially breast milk contains everything an infant needs. Obviously, we're supporting exclusive breastfeeding for the first 6 months. So that means it has the protein, it has the fat, it has the carbohydrates that a baby needs to grow. And it changes as time goes on to meet that baby's needs. But the other big purpose of breastfeeding, and especially that early latch and taking colostrum, is immunity and the immune benefits of breast milk. And we can think in a way about those early feeds as being the baby's really first vaccine, really getting great immune protection from the birthing parent that way. Another big purpose of breast milk, and we're learning more and more about this as time goes on, but both of these factors likely impact the infant's gut microbiome, which has likely lifelong impacts on any person's health. So that's kind of the baby side. And then on mom's side, we know that breastfeeding reduces the risk of certain types of breast and ovarian cancer, reduces the risk of diabetes, and reduces the risk of high blood pressure as well. And I should have mentioned also with the baby that in addition to that kind of first vaccine, those immune benefits pay off in the long term with reduced risk of ear infection, reduced risk of upper respiratory infection, reduced risk of severe GI illness, reduced risk of leukemia. The list goes on. I could tell you more, but there are many.
I've always heard that breastfeeding helps the mom lose weight too.
Yes, that can be a factor. I think that can be different for each birthing parent's journey because there are also increased calorie needs during breastfeeding. So sometimes that's the case, and sometimes that's not the case, and that's okay too.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Cheryl Dumond-Martinez, who specializes in pediatrics and breastfeeding medicine at Upstate. What sorts of questions do new parents commonly have for you about breastfeeding?
I'll say a little bit about my specific role when I answer that. I am a breastfeeding medicine physician, which means that I am trained as a pediatrician, and then I'm also board certified in breastfeeding medicine, and I'm a lactation consultant as well. Then we also have often another type of breastfeeding support, an IBCLC, a lactation consultant that might be a nurse or have other background. So when I see patients, sometimes I'm seeing a little bit more medically complex dyads. I see both the mom and the baby as patients. And so I do see patients for kind of quote unquote basic breastfeeding needs and antenatal education as well. But I also might see patients for a complex situation where there are factors involving mom's health, as well as factors involving the baby, which both impact the breastfeeding relationship and might involve further workup or medication prescription as well. So I would see a dyad that maybe mom is experiencing pain and the infant is having difficulty latching, or there is low supply. These are all different issues that I would see families for.
If a family is preparing for the birth of the child and has plans to breastfeed, is there anything that they need to have on hand at the home?
This is a really good question. And a lot of families are working hard in advance to prepare for the delivery. And sometimes I think there's a lot of marketing of products related to breastfeeding. So I think my first rule of thumb would be sometimes the fewer the gadgets, the better, because sometimes they can actually get in the way a little bit of breastfeeding. So I would say there are a few things that I think anyone should have on hand, but trying not to look at everything on the internet and buy all of the products. First of all, I think not everybody needs to pump. Sometimes they do, and sometimes they don't. But it helps if the need arises to already have your pump at home and have some familiarity with it. And everyone who is giving birth should have the benefit of a breast pump covered by their insurance. That can be arranged in advance, and you can have that already at home. And that really helps if the need arises. Many people early on, especially their first time breastfeeding, can some pain, some nipple pain. And it can help in advance to have a few products to help. And one of those is a product called a hydrogel. And if you're experiencing a lot of pain, I think it always helps to reach out at that time and speak with your physician or your lactation consultant. But that's one that's nice to have at the ready at home in case you develop pain.
What about if someone's planning to breastfeed? Would there be a need to have bottles available?
I think not always. Sometimes when a dyad is exclusively breastfeeding early on, there's no bottle introduction. But I would say most families feel comfortable having that option if they end up deciding to pump and express milk and feed through a bottle. They like to have that on hand already.
There's been a lot of talk on social media about the importance of having a freezer stash. Can you explain what that is and if it's something that people need?
Yeah, I think this is a really important issue. So, a freezer stash, what people are seeing a lot on social media is that breast or chest feeding parents have been able to build up a very large supply of breast milk So there's milk available in the refrigerator if needed to feed the infant, but then so much milk built up that they're actually able to store that in the freezer. And sometimes this can be very, very large volumes. The challenge with this is that a lot of times excess milk is not needed, especially for a healthy term infant. And new parents can feel a lot of pressure when they see that and think that that is what is necessary to feed their baby and that they need to work up to this amount of breast milk. But in order to be saving that amount of breast milk when you have a term healthy baby, it means that you're producing way more milk than you need on a daily basis. And the real downside to that, we call that oversupply or hyperlactation, is that sometimes these parents are experiencing other complications like plugged ducts or mastitis or just a lot of pain in their breasts and their nipples. And that can be really challenging too. But like all things on social media, sometimes we see only one side of that. And so a lot of people are not showing the more challenging side of that. So I do encourage families to really think about if they have a term healthy infant, focusing on feeding on demand and keeping their supply just what baby needs and not trying to really develop a significant oversupply that could ultimately be a big challenge for the mother.
So, is this happening among moms planning to go back to work, or where did this start?
Yeah, I think that a lot of parents develop some worry about return to work and making sure they have enough to feed their baby. But really, when we think about preparing to go back to work, you need only the amount that the baby needs for the first day. So if you're working a 10-hour workday, 8-hour workday, you only need the milk that the baby would need during that time saved and ready to go. And then each day you'd be pumping and have the milk for the next day. So it doesn't need to be many, many, many ounces stored in the freezer. The other time, though, that this happens, and this is a challenging situation that a freezer supply is common, is when there is a baby in the NICU. And that is understandable. That makes a lot of sense because the infant is really tiny and is taking very, very small volumes once they actually start to take breast milk. So it's almost unavoidable in those circumstances to have quite a large over or extra supply of milk.
Now, I wanted to ask you, is it safe for a mom to breastfeed if she's sick with a cold or a flu? Would that affect the baby if she's breastfeeding?
I think depending on the situation, it might help to talk with your physician about the specific illness. There are a few illnesses that we would say no. However, the large majority of times that a mother is ill, she can absolutely breastfeed her infant. And actually, that can be really beneficial. So if the mother is sick, she is mounting her own immune response and does pass on some of that protection to the baby. So that is actually very helpful with something common like cold or flu, very helpful. And if she's having a lot of respiratory symptoms, she could always wear a mask while she's breastfeeding.
Do you recommend that parents to be sign up and take a breastfeeding class before the baby's born?
Yes, I do think that that can be very helpful. It's very helpful to get a general sense of what it will be like to breastfeed and some general expectations. I think that preparation helps a lot, but a lot of times families will still feel like nothing prepares you for the real experience itself. But if you go into that armed with some knowledge, I think it does make it a little bit easier.
That's good to know. Upstate University Hospital offers classes for people that are expecting?
Yes, the Family Birth Center at Upstate, which is located at Upstate Community Hospital, offers Best Beginnings Childbirth and New Family classes. This does include classes related to breastfeeding specifically, and they are free and available to anyone. You don't have to be giving birth at that location.
Well, I appreciate you making time to talk with us about breastfeeding, Dr. Dumond-Martinez.
Absolutely. Thank you so much for having me.
My guest has been Dr. Cheryl Dumond-Martinez, a pediatrician and breastfeeding medicine physician in Upstate's Department of Obstetrics and Gynecology. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes and transcripts at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.